Hello everyone, my name is Lawson. I'm a final year student at Purdue University. Today's topic is on epidemiology of depression in adolescents. The components of epidemiology comprise of the prevalences, the gender differences, and age of onset. According to World Health Organization 2019, 20 to 15% of adolescents experience depression, and females are more likely to be diagnosed with depression during adolescence, according to American Academy of Pediatrics 2016. Depression can onset as early as pre-adolescent and often peak during mid-adolescence. Risk factor, genetic predisposition, environmental factor, and biological factor. A family history of depression increases the chance of one having depression. Also, peer pressure, academic stress, family conflict, and trauma. Also, the biological factor like hormonal changes and neurotransmitter can also predispose or stand as a risk for individual to have depression. What are the subjective findings of depression? We have the common and the uncommon subjective finding. The common subjective findings are the persistence, sadness, hopelessness, irritability, change in appetite, and sleep disturbance. Uncommon aspect of it are suicidal ideation, severe anxiety, physical symptoms like headache or stomach ache. There are some illnesses that may make depression. These are not as a differential to consider. Anxiety disorder often co-occur with depression, and bipolar disorder, the manic episode, can be mistaken for irritability. And substance abuse, such as substance abuse, can exacerbate depression symptoms, and eating disorder share risk factors and symptoms. How perfect a clinician or a provider can arrive to a diagnosis of depression. These are known as diagnostic works up. The clinical interview, data history and mental status examination are critical in diagnosing or arriving at the diagnosis of depression. Screening tools such as PHQ-9, GAD-7, Beck depression inventory are also crucial. Then, talking about the laboratory tests may include thyroid function tests, vitamins level. Also, we need to assess an individual psychological aspect of life, just such as the cognitive and behavioral assessments. What are the potential abnormalities that can be found in an individual with depression? We talk about the cognitive impairment, that is difficulty concentrating and memory issue. Then also we have the emotional dysregulation, which are the intense mood swing and feeling of worthlessness, behavioral change such as withdrawal from social activities, change in sleep and eating habits as we earlier discussed. Now that we know that individuals have we have arrived at a diagnosis of depression, we have to talk about the plan of care. The plan of care for an individual with depression involves pharmacologic intervention such as antidepressant, which the common first line of treatment are the SSRI, such as fluoxetine, SNRI, such as sertraline. Also, we have to monitor the effectiveness of this medication through a blood test, or we can also evaluate the side effects to know if this medication is suited for that individual. Then we talk about the non-pharmacological intervention such as psychotherapy, CBT, and interpersonal therapy, IPT, are very commonly used. The lifestyle modification are very necessary. Regular exercise, balanced diet, and adequate sleep can help an individual with depression. We cannot overemphasize the importance of psychosocial need of an individual with depression. We talk about the family support system, which strengthens family and peer support. Then we talk about the counseling service, referral to a school counseling and a mental health professional to actually form a comprehensive network that will help this individual. Education is a vital key to a patient healthcare. Patient education about depression, treatment options available, medication side effects, and importance of taking their medication as prescribed. Family involvement, such as family education, and also we create a kind of supportive strategy that we incorporate the family and the patient into their own care. Then also health promotion is and maintenance is very important. Here, administering the medication, putting the putting the patient into his optimal self, and also helping them to achieve a steady and maintained support to avoid relapse. Then routine checkups such as regular mental health assessment and lifestyle support that encourage healthy habits and stress management techniques. Referring the patient to specialist care is very important. Depending on the patient validity or the importance of the care that is actually needed. For a primary care provider, creating a solid network that will involve an interdisciplinary care of a patient is very, very paramount. So referring this patient to a psychiatry, a psychology, or social worker and a social work are very important. Then we should not leave out the social group for adolescent mental health support, which are also crucial for the well-being of this individual. Finally, prevalence of mental depression is 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 high in the society, and it's one of the common mental illness that an individual seek help for. So we should not, as a provider, should not forget the importance of creating a greater a strong network that be beneficial to the patient, and also not to forget the importance of education in mental care and referral network. References as written below: American Academy of Pediatrics, National Institute of Mental Health, World Health Organization. So thank you for listening. Have a wonderful day.